Hello, my name is Wen Shen, and I am in the Department of Gynecology and Obstetrics, and specifically in the GYN Specialties Division at Johns Hopkins. And my area of focus is menopause medicine. And I run the menopause clinic as well as teach the residents about menopause medicine in the resident clinics. And so today, my talk is going to be about menopause, why menopause is important, that it is beyond just bikini medicine, and that it actually is more than just the hot flashes, the night sweats, and painful sex, although those symptoms can severely adversely affect a woman's quality of life, but it's more than that, okay? So let's go ahead and start talking about it. Menopause, there are 75 million women in the US that's in menopause, and that's the estimate, the newest estimate that we have. The average age of menopause is 51, but it ranges anywhere from 40 to 58. Although some women can have premature ovarian failure and go into menopause as early as their teens. And approximately 2/3 of women live to be 85 years old in the United States. So as you can see, most women will spend a third of their lives in menopause, post-menopause. So that is a very important part of a woman's life, and especially during those decades, she is still very, very much professionally busy. She is busy with her family and as well as other commitments that she may have. So those are very important decades. Menopause is a normal, natural event. If a woman lives long enough, she will go into menopause. I do have a couple of patients who are closing in on 60 years old, and they are still menstruating, and they are just a little bit disgusted with still having periods, but they will go into menopause. It's just that for them, their physiology has continued with ovulation. And menopause really is a loss of oocytes. Those are the eggs that your ovaries make. And so partly is because you've used up all the eggs with every cycle that you menstruated throughout your reproductive lifespan, and partly also because the eggs that did not get used in your ovaries will then go into atresia. In other words, they will just kind of dwindle away. The symptoms of menopause are varied, okay? And so some women can have humongously disturbing symptoms, and other women will just be nothing. They just stop having a period and nothing else happens. So it's a huge range. But the average woman will experience the roller coaster symptoms of menopause. And that is due to the fact that her hormone levels are varying greatly. They are doing the roller coaster thing. And so because of that varying levels of hormones, her symptoms can be all over the place. And she will think that, very often a patient will come in and tell me that she thinks she's losing her mind. And I reassure her that no, she's not losing her mind. It's just that her ovaries aren't behaving. And that's why she's having all these symptoms, and they tend to be all over the place. And that is one area where menopause hormone therapy comes in and helps these women stabilize their hormones, and they then can restore themselves to their normal quality of life. With the obesity epidemic that's in the United States right now, most women who are obese tend to have more symptoms during the perimenopausal, premenopausal stage. So they tend to have much worse hot flashes and night sweats and irritability, whereas women who are obese may have less symptoms once they become postmenopausal. So let me define. Premenopause is basically any woman who is still in her reproductive age. Okay, so that, as I said, is up to about 51 in the United States. Perimenopause, P-E-R-I, perimenopause is that decade about 40 to 50, when most women have the worst symptoms. So women who have premature menopause are women who stop having spontaneous menstrual periods and start having menopause symptoms before the age of 40. And once a woman has spontaneously stopped having her periods for 12 consecutive months, she is then defined as being postmenopausal. So after that, she will forever be postmenopausal because you don't go back and forth between being postmenopausal and premenopausal. For most women, once the ovaries stop functioning, they stop functioning for good, and the woman remains in postmenopause. And the term menopause encompasses all these different phases of menopause that I just discussed. And we know also that women who suffer from depression, anxiety, had severe PMS symptoms in their younger years tend to have more symptoms as they're going through their menopause transition. So now let's talk about the medical issues of menopause. So as I said, menopause is a lot more than just bikini medicine. Menopause is about living the rest of your life, and that's a third of your life in the best possible health. And one of the most important elements is cardiovascular health, okay? Heart disease is the leading killer of women worldwide. 1 in 3 women will die from heart disease. In fact, more women die from heart disease than men do. And there is a relationship between menopause and cardiovascular disease, because we know from clinical trials of women who have premature menopause before the age of 35, these women have a 2 to 3 times increased risk of having a heart attack. So it is very, very strongly shown that both estrogen and progesterone receptors that are present in all the blood vessels, in the heart, in the coronary arteries, are very much influenced by the level of estrogen and progesterone that is in a woman's system. Estrogen and progesterone also affect the coagulation factors. These are the different factors in a woman's blood that causes her blood to clot or not to clot. And so if the coagulation factors increase after menopause, she is at increased risk for clotting, and hence things like pulmonary embolus, things like atherosclerotic disease in her heart, and also strokes. These are all affected by increased clotting of blood. There's also decreased flow of blood to all the vascular beds after menopause. So decreased flow of blood to the skin, to the hands and feet, to every organ, to the brain. So these are all very, very important changes that happens to a woman after she becomes postmenopausal. And many of these changes actually start while she is perimenopausal. So if a woman has very severe symptoms in her perimenopause, she shouldn't think she should try and tough it out. If the symptoms do not improve with just lifestyle changes, and if they continue after 6 months and they're still torturing her, then she should have that conversation with her doctor about menopause hormone therapy. And the next disease entity that is very, very important to women after menopause is osteoporosis. And a lot of people think, oh, osteoporosis, so I shrink an inch or two, no big deal. It is a big deal. 1 in 2 postmenopausal women will have osteoporosis related fracture in their lifetimes. And the important thing about osteoporotic fractures is that they are fragility fractures, okay? So most of us would think about bone fractures as when we were young, went skiing and broke a leg. And so the orthopedic person puts your leg in a cast, and 6 weeks later takes the cast off and you're fine, okay? No, that doesn't happen when you have a fragility fracture. Fragility fractures don't heal because of decreased blood flow to the bones. The bones are not as strong, so they don't heal the right way. And a large portion of people who have osteoporotic fractures never regain their quality of life. They become dependent on others for transportation. They become dependent and less likely to be as involved in activities, and very often will go into isolation and depression. And so it is a very important factor to maintain healthy bones. So, and also on this slide, you see that there are differences in risk for osteoporosis between the different ethnicities. And African Americans have the best bone mineral density versus all other ethnicities. And then the Asians have the lowest bone mineral density as a whole. Okay. And then the last item that I would like to discuss is Alzheimer's disease. That I know has gotten a lot of press, and most of my patients who come in, that is their worst fear, because they know how much that could affect a person, or they have seen in their own families people who had Alzheimer's and how horrible a disease that is. And the worst part of it is that it has a higher risk in women, okay? So 11% of the general population, that's men and women, will get Alzheimer's, but it's higher incidence in women. The disease comes on more abruptly, and women die from Alzheimer's than men. And Alzheimer's disease is very often expressed as dementia in women. And unfortunately, there is a maternal genetic factor, the mitochondrial inheritance. So if your mother had Alzheimer's disease, it would be very, very important for you to have that conversation with your doctor and possibly get evaluated and see if there are any recommendations for possible preventive steps that you can take. Because once you're diagnosed with Alzheimer's, it's almost a too late sort of situation. And there is a lot of research being done on Alzheimer's. And so if you were to enter yourself into an Alzheimer's registry, which exists at Johns Hopkins Bayview Medical Center in the Aging Center, they will get you on the list and see if you qualify for any of their studies, or just to update you on any new information that they may have. So let me ask you a question. What do you think? The Gallup poll found that postmenopausal women are the happiest and most fulfilled of all age groups. Is that true or false? It's true. Okay, so it is a very rewarding time of a woman's life. However, severe perimenopausal and postmenopausal symptoms can, as I've been saying, adversely affect a woman's life. So if you feel like this bluebird of happiness here that does not look very happy, you need to consult with your doctor or come to see me at my menopause clinic and discuss what can be done to restore you to being a bluebird of happiness. And hence, let me talk a little bit about the Johns Hopkins Women's Wellness and Healthy Aging Program. This is a program that I co-direct with Dr. Vera Sturms, who is a breast oncologist at Hopkins. And that's because we see between us many women who have either increased risk for different medical illnesses, or women who already have breast cancer. And we see the issues and all the medical management that they should have in order to continue to live a healthy, active life. Especially now that breast cancer has advanced so much that if detected early, many women continue to have a normal lifespan, having perfectly high quality lifestyles. So this program, we feel, is the future of women's midlife care. And this is to facilitate women in self-care during their post-reproductive phase of their lives. Because as I said before, most women who are going through menopause at 50, 51 have a lot on their plates: family, work, community engagement. And so most women need proactive health care. So although, as my Gallup poll slide showed, menopause can represent a watershed of challenges to a woman's overall wellness and sense of well-being. So it is something, it's also a time when she can have the most rich and rewarding times. So maintaining her health and wellness during all of this transition is very important. And the goal of our program is to streamline the disjointed care delivery system and to create a roadmap for the patient and her primary provider to improve the overall health of midlife women, to prevent or ameliorate any age-related conditions, and to improve the overall wellness of themselves, their families, and friends, and all the lives that they influence. So this consultation program is meant to help a woman have a clearer picture of what she may be at risk for, what she needs to do to make sure that she maximizes her health, and to refer her to all the different experts that are available at Johns Hopkins who are at the top of their fields to help this woman age in the best way possible. So if you have any questions or if you would like to make appointments with the program, especially now with the COVID and even after COVID pandemic is over, we have telemedicine visits to make the consultation easier and more efficient. And so please, you can email us at the Women's Wellness at jhmi.edu, or you can call the number 410-583-2749 in order to make an appointment for either a video visit or an in-person visit in the clinic. And we look forward to speaking with you, and I hope this short presentation has helped elucidate some of the issues around menopause and that it's more than just bikini medicine. Thank you for listening.